Hi, my name is Joseph Salazar, and I'm doing a recording here for my DAT class, Corrective Techniques of Movement Dysfunction. Miguel, do I have your permission for my online DAT course, Corrective Techniques for Movement Dysfunction?
Yes.
My video here is going to present some breathing exercises that I would normally do here at the professional level, kind of from an evaluation to an entry-level exercise program and advance into an advanced progression. This patient has some history of low back discomfort that he has intermittently, and we're going to try to see if we can fix some of those problems. First, what we do is we get the player on the table and we're looking at how well they breathe. I know this week's lecture is about breathing, and so this would be a good opportunity to kind of go through what we normally do from an evaluation and progression exercises. We normally keep them in a supine position and their feet are bent here. We're going to look at his apical expansion and see how well he breathes. We've determined if they're chest breathers, abdomen breathers, how well they're using their diaphragm, as well as see if there's any difficulty breathing from a cervical musculature during their breaths. So Miguel, what we're going to do is I want you to do just some nice deep inhalation and exhalation. Take real deep breaths in and then deep breaths out.
Okay.
And all the way out. And then nice deep breaths all the way in. Deep breaths, and then back out. And do one more. Take a deep breath in, and then deep breath out. So from this subject here, notice that he's a big chest breather. He uses a little bit of his STM, some scalings, and you can see how his chest will rise more towards the top of his head as opposed to expansion here. Uses a little bit of his abdomen when he takes breath. So what we normally do is we'll do a apical expansion test to see how well he breathes. So Miguel, I want you to do the same thing. I want you to take a deep breath in, and we're trying to see if we can transition his breath into his right side, and then we'll check it bilaterally as well. So Miguel, in a second here, you're going to take a deep breath for me. Okay? Go ahead and take a deep breath for me. Deep breath. And then go back down. Good, one more time. And relax. Good, relax. And as you can notice on this test here that he has a difficulty trying to get some breath into his right lung cavity. He has a difficulty trying to take those deep breaths in there, so he's definitely will be a negative test for the apical expansion test. What I'll do is I'll do the reverse just to compare. Okay, deep breaths for me again. And then out. Deep breaths. And back out. Very good. And relax. And you can see it was easier to have him take the breaths into his left cavity versus his right. So he actually has a negative apical expansion test on this. So we will progress him from his breathing. We'll do this exercise a couple of times until he's able to progress to the next one. Due to the nature of this video, we're going to do is the next phase of our exercise here is we introduce him to a PRI exercises. Not only are they going to assist with his symmetry of his pelvis as well as his rib flaring that he has. He actually has a external rib on his left side, internal rib on his right side, allowing him to be more of an upper chest breather. So Miguel, let's get you on a 90-90 position. We call this our 90-90 position relocation test here. Basically just introducing him to the 90-90 position of PRI. We have the patient supine. They're at 99 degrees here. What he's going to do is he's going to contract his hamstring. He's going to do a little bit of a pelvic tilt here. He's going to tighten his hamstrings. And then as he takes normal breaths, using his relaxed abdomen here, he's going to go through, let's go 3 breaths. As he contracts his hamstrings, he does a pelvic tilt. And then what we do is we do the reposition of the 99 position where he's going to bring his right hip out as a shift, and he's going to maintain that position as he relaxes his abdomen, tightens his hamstrings, and he's going to go through his normal breathing here where he's going to inhale and exhale 3 times for me. And again, here we're looking at to see how well he's breathing. His exercise model maintains the 99-degree position. And we do this until the player is able to maintain not only good breathing techniques, but he's able to hold that position on that 99 position of the PRI. And relax. Once he gets this established, we advance him to a next one where he is going to be doing the similar type breathing 99-degree position with a balloon, as we have read in this week's reading during the literature. This exercise here will enlist the patient to actually inflate the balloon while learning to use his abdomen and his diaphragmatic breathing here, and less of his upper chest and cervical musculature during this exercise. So Miguel, we're going to do the same thing. You're going to hold your hand out in that position. You're going to posterior tilt or anterior tilt his hips. He's going to contract his hamstrings again. He's going to do a shift, and he's going to blow up the balloon here, and he's going to do that 3 times. Again, every time he's going to try to expand that balloon with inhalation. So go ahead and take a deep breath for me. He's going to inhale, and then he's going to exhale into the balloon. Blow, 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 blow. And then take a deep breath, breathe breath. And then exhale again. Exhale, exhale, exhale. One more time. Deep breath, deep breath, deep breath. And then exhale, 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 exhale. And relax. And you can tell he has difficulty not only using his abdomen doing his breath, but he has a hard time for him to create that balloon as he breathes through his chest as opposed to his abdomen using his diaphragm during his exercises. And that concludes for the video for this week's post.